I am Zulema Salazar. Welcome to this program tonight, Storytelling, and I hope you stay with us for 1 hour. I promise you will enjoy. And now we are going to start our stories about belonging. Our first storyteller joined the Primary Care Coalition in April as the new director of healthcare quality and collaboratives. And she will do absolutely anything for a bag, believe it or not, of plantain chips. She's been to 33 countries, but now calls Montgomery County home. Please welcome the fabulous Faith Maca. Faith.
Have you ever tried jalab? J-A-L-L-A-B. Jalab. I highly encourage you to try it out. It's an oh so refreshing drink made from the syrup of dates, grape molasses, rosewater, and then smoked with Arabic incense and served chilled. It's popular in places like Lebanon, Syria, and Jordan. Okay, what about olibrol? It's an interesting name, huh? It's a savory Danish breakfast porridge made from rye bread and best served with milk and whipped cream. It's highly yummy, and you know, I really could go on and on and on about interesting international cuisine because, you know, I naturally love food, all sorts of food, and I consider myself a citizen of the world. You see, as a young girl growing up in Nigeria, during my early years, I went to an international school for elementary, middle, and high school. Our student body looked like a United Nations summit. We had yearly international food festivals, talent and dance shows celebrating different cultures. My friends were from all corners of the globe: Lebanon, Ethiopia, India, Kenya, Denmark, Australia, and of course the United States. It was diversity utopia. We all coexisted and did life together as one big happy family. And we were all celebrated as unique and different parts belonging to a bigger whole. Unique and different parts belonging to a bigger whole. Despite this culturally rich environment, can I share a little secret? I yearned for America and fantasized about all things America. The red, the white, the blue. I remember dreaming about what an Oreo would taste like. That ethereal white filling sandwiched by those 2 decadent chocolate cookies. I wanted to watch an American football game so bad and visit Times Square and see the Statue of Liberty. I got an opportunity to move to the United States as an 18-year-old to attend college. And in the years to follow, I have since come to find out all the glorious things that America has to offer. Let's just say whoever invented the Chick-fil-A waffle fry deserves a Nobel Peace Prize. Chick-fil-A is my happy place. I've come to live in so many incredible places, from the marshy swamps of alligator country in Florida to the majestic mountains and rolling hills in New Mexico. From sea to shining sea, this country is beautiful, and there's a lot that is truly great about America. And there's also a lot about America that's not so great. I remember the first time it dawned on me that I might have lost my status as a celebrated and unique but different part belonging to a bigger whole. Freshman year, Fort Worth, Texas, Sociology 101. I vividly remember the discussions we would have in class about socioeconomic status, income, education, health. I first heard that curious word, minority. I wondered what that was. And I brushed it off thinking, it must really suck to be one of those. I mean, they have all the worst outcomes and the statistics don't look good. It almost seems like the odds were stacked against them. And a few classes later, it dawned on me and hit me like a ton of bricks. I realized that I was a minority. Whoa, OMG. I was a minority. Oh dear, okay, breathe, Faith. I'm a minority. Upon coming to America, this is the title and an identity I've had to take on and live out. As a Black female navigating my way through this country, Whether through the walls of academia or through professional spaces, I will admit there have been many times I have not felt celebrated as a unique and different part belonging to a bigger whole. Sometimes I felt very other. Like the time I was looking for a new apartment to rent, and the landlady told me, "I love you, I want to rent to you, but this is a conservative neighborhood. I'm not sure how the neighbors will take it." Take it? To take what? Oh, take me. Okay. You know, as humans, we are all born for connection, physically, spiritually, and socially. We all want to exist as valued, treasured members of a whole. And I'm no different from anybody else. I want to feel connected and valued. So as I progressed in my healthcare journey, both as a health administrator and a nurse practitioner, I made inclusivity my life's mission, remembering those who were seemingly easily forgotten and overlooked, whether in rural India, or in the backwoods of Georgia, or in reservations in New Mexico, and now right here in Montgomery County, Maryland. I'm extremely proud to be part of an organization that makes healthcare happen for those on the margins of our community and brings them back into central view by carefully considering their health needs, their social economic challenges, and the inequities caused by social structures put in place that hurt many. I joined the Primary Care Coalition as the Director of Quality and Collaboratives, and in this role, I oversee clinical quality for a network of safety net primary care clinics, as well as a network of specialty care clinics. Their sole mission is to ensure that vulnerable residents have access to high quality care and feel like celebrated, unique members belonging to a bigger whole. In this year in particular, the vulnerable are even more vulnerable as COVID-19 has revealed the stark inequities that exist within our communities. The Primary Care Coalition strives to ensure vulnerable residents have a soft landing and are able to receive preventive services, immunizations, specialty care, and vital medications just as any other member of society would. The message that sends is you are valued. You belong here. We've created a place for you, a place where you belong. So I'll end with a call to action. Just like the Primary Care Coalition is doing, we all should seek out ways that we can make those around us in our day-to-day be like they belong, that they are celebrated, unique and different parts belonging to a bigger whole. Thank you.
Thank you, Faith, for kicking off our show in style, and I hope you have a bag of cheese plantains tonight. Thank you for sharing your story. And now we will hear from PCC's Nurse Case Manager for the Care for Kids program, Joanna Rivera. Joanna never tires of watching NCIS, even after 17 seasons. Can you believe it? She's also famous for making incredible, delicious flan. So her flan is always in demand at office potlucks. So I hope next time, Joanna, when you make a flan, you need to save a piece for me, okay? So now take it away.
The human body has always fascinated me. And I'm not just talking about the bodies of humans like Channing Tatum or Dwayne Johnson. I mean, the human body in general and all the amazing things it can do. I love learning about the body's intelligent design, the complexities of the brain, and how different body parts work in harmony to make a single movement. I marvel how quickly the human body can heal, even after hundreds of scraped knees. My fascination with the human body led me to decide that at 16, I wanted to become a nurse. And why not? It's the perfect combination of sciences, education, and helping people. All great things. Only, I was the only one at the family who felt that way about nursing. I hear, you'll be cleaning old people's butt all the time. But I didn't care that nursing wasn't for everyone. In fact, that made it more special for me. So in 1999, while Prince was preparing to party, I enrolled in a nursing degree at the University of Puerto Rico in Mayagüez. I loved my first year of nursing study, and then the summer of 2000 brought me even more adventures. The highlight of which was meeting and falling for a cute Salvadorian against all odds and geographic livelihood, since he lived an ocean away in the United States. Naturally, we got married and I moved to the United States to be with him, which means that I also gave up my beloved University of Puerto Rico to transfer to the University of Maryland. It was the year of drastic changes. I became a newlywed. I moved to live in a new home, in a new country, after leaving my family behind in Puerto Rico, and later I was expecting our firstborn. I was doing it all without speaking much English. Learning English was crazy hard. I remember a professor told me, drop the class. You need more English to take it, and I don't want to make your life miserable. So I did. As a child, my mother embedded me something in our minds. Study, become a professional, be independent. Our son was 3 months old when my husband suffered a terrible injury at work. I still wanted to become a nurse, only we couldn't afford the cost of tuition at American universities, let alone a babysitter. If I returned to Puerto Rico, I could complete my nursing studies for free, live with my parents for free, and even get babysitting from my mother free. The free trifecta. Given the circumstances, I had to make a huge sacrifice that still hurts today. I had to leave my husband behind for 3 years to complete my nursing degree in Puerto Rico. We had been only married for about 15 months when I moved back. There was no FaceTime, there was no Zoom, no Skype. I didn't even own a cell phone. I called him using prepaid cards. While in school, I had a plan: work in a hospital as a bedside nurse. I would never consider committing to nursing, pediatrics, or management. After my graduation, I returned to Maryland with our son, a nursing degree, but no nursing license. We had to adapt yet again of being a family of three. Even after all the sacrifices, I didn't belong in the nursing field because I didn't have that tiny certificate to allow me practice nursing. I had to start from the bottom again, working in a temp agency as a medical assistant. Once the agency placed me at Mary's Center, I learned a lot there as a medical assistant, but it was still determined to do more. A nurse director who became my first supervisor trusted me. She offered me a position as a pediatric manager in the condition that I had to take the boards within a reasonable time to change my title to pediatric nurse manager. And I did. I passed the boards. Oof, what a relief. With this position, I had to do management, pediatrics, and community, the three things I said I would never do. But this position opened a new world for me. It allowed me to make contacts within the community and help others from diverse countries, needs, and languages. I had to learn to leave my Puerto Rican accent behind and start speaking in a clear, simple terms. It was hard work, it was long hours, and I'm going to admit I cried. Still, it was gratifying. While working at Mary Center, I got to know Marisol from Primary Care Coalition. Getting to know Marisol and the Care for Kids program encouraged me to apply for a position at PCC. It was not an easy decision to make, but I saw an opportunity to do something different. After serving Mary Center for 6 years, I joined PCC in 2011 as a nurse case manager. I missed my previous jobs hand-on clinical nursing, the children, the co-workers, the team. I wanted to go back to my patients, but Marisol reassured me, think about your helping at a whole other level. It may not be in a clinical way, but trust me, you'll help your clients greatly, and you can reach more people this way. I trusted her. She told me PCC offers many children, adults, and seniors the opportunity to access healthcare. And she was right. Every day, I get to touch the lives of many children and their families. I must earn their trust in a minute or two, just so they can open up and tell a stranger about their problems. I get to connect children to primary care services, specialty care, dental, and behavioral health services. I help them to get medications they might not be able to afford. It has been 9 years since PCC welcomed me into their family, and I still look forward to helping the increasing number of children and families in the county with different needs. It's busy and it can be mentally draining, but I have the personal satisfaction that I'm giving back to the community. This is indeed where I belong.
That was wonderful, Joanna. Thank you very much. And please keep the hard work with our community. And remember, send me a flan. No sé cómo se dice en Puerto Rico, pero guárdame el flan. Algo de, bueno, se me olvida el nombre, pero now we will hear from Joanna's husband, Ruben Reyes, Director of Operations at Mary Centers. After his wife and kids, Ruben's next greatest love is reading nonfiction books, which is how he stays so in the know. Thanks to his father's tailor's business, Ruben also knows how to sew and iron his own clothes impeccable. Please give a warm welcome to the always sharply dressed Ruben Reyes. Bienvenido.
Have you ever noticed how a night that's about to change your whole life starts just like any other night? For me, that meant grabbing the lunch bag my wife had lovingly packed, kissing my son, my wife goodbye, and calling, see you in the morning before heading out toward the night shift. About halfway into my shift, while cleaning the machinery, I felt a drop of a disinfectant spray fall into my right eye, and I ran to wash it out. Within an hour, my vision's blurred. I notified my supervisor who rushed me to the hospital. There, we found out that I had multiple second-degree burns in my right arm. I spent the night in the hospital. The nurse flushed my eye for hours and treated my wounds. The next day, I was discharged and referred to an ophthalmologist. I thought that this was just a minor accident, not a big deal. But as time went by, and in spite of all my doctor's appointments, nothing had to lessen the pain. On the contrary, my pain was increasing. I finally received 3 letters diagnosis from a neurologist. You have RSD, he said. I said, what? RS what now? He replied, you have reflex sympathetic dystrophy, better known as complex regional pain syndrome. It was like he was speaking Chinese. I didn't understand a word of it. And I was too shocked to say anything or ask questions. I just stumbled out of his office and I stood in silence. During that time, and without knowing of future complications, my wife and son returned to Puerto Rico so she could complete her nursing degree. So I was dealing with my condition and getting doctor's appointments on my own for 3 years. We communicated by phone with my wife, and while living alone, I kept the apartment dark with all curtains closed and lights off. I could not tolerate a sunlight nor a noise. And you may wonder, how can a little pain bring an adult man down? That's a fair question. The pain was unlike anything I have experienced. A burning pain that turns into my relentless stabbing and feels like my bones are being pulverized. That is my new normal. As you can imagine, when my wife and son visited over a break and eventually moving back, there were many disagreements between my wife and me. As she loved this house to be light and breezy, I wanted to be in solid darkness. Every morning I would pull down the shades to minimize the painful light, only to sigh in surrender as she pulled the shades back up, saying, it is a beautiful day. And I feel desperate when our baby son was playing and making baby noises. The medication prescribed to manage my pain turned me into a zombie, and not the comic cool zombie way of many modern movies about a zombie falling in love. I was sleeping most of the time, and I let my hair grow long. I didn't shave. I allowed the pain to drag me into a hole where I could see no hope. Nothing makes make any sense for me. I couldn't even enjoy the simple thing to in life like going for a walk or playing with my son. Oh, and did I mention it that later that year I lost my job? Yes. The company fired me because I could no longer physically able to perform all my duties. I was spiraling down quickly until one day during an appointment, my neurologist said something that made me rethink everything. He said, if you do not want to be part of those statistics who commit suicide because they cannot manage their pain, hmm, I would advise you to think about it. Think about your family, about your son, about your wife. Who's going to look after them if you are gone? You need to do something to reintegrate into society, to find a way to live again. His words touched me profoundly. I knew I had to do something for my well being. I could not continue living like this. My first step in the process was the simplest one: got a haircut. Then I applied to college, took English classes, and completed a degree in accounting. In 2005, my family was back together, and then a couple of years down the road, we were blessed with the birth of our daughter.
Responsible.
We were delighted to welcome the baby girl, but I was also worried about having another mouth to feed, as I was still unemployed. Then, after 6 years of unemployment, someone at the Medicine Center, one of PCC many partners organizations, someone there, believing in me, gave me a chance to work as a referral specialist. It was a brand new field for me. As my young trainer taught me the different ways we serve our community, she inspired me, her strong belief in our work. Among the thousands of patients we help, some had terminal illness and yet would arrive after chemotherapies with big smiles on their faces. Without knowing how many days they have left, they still enjoy every day to the fullest. I became more thankful for my life and my family. I felt blessed even with a regular pain. It has been 18 years since my accident, and back then I couldn't find a place to belong. But since I started working for Medicine Center, I've been reborn. Though the road to get here hasn't been easy, I had to learn the system and the gift of patience. I had to adapt and grow as a human being and develop professionally by completing higher level of education. I am no longer depressed, and now I feel that my life has purpose. I understand that it's in spite of my limitations, I can still impact others' life through my work and service. I live every moment with a positive mind, trying not to think about my chronic pain, but considering how I can better serve those in great needs. I am blessed with a loving family. My beautiful wife who still puts up with me somehow, my amazing son who's now 18, and my daughter, my wonderful daughter, she's 12 years old. Both make me proud every day. I even have a dog now. Life is good, and at last, I can say it, I belong. Thank you.
Thank you, Ruben, for sharing this powerful story. And also, we have a live chat right here, and everyone is so excited about the stories. They love Faith's story, Joanna's story, Ruben's story, and I love to read. For example, Marisol said, "What a powerful story, Ruben!" Applause for everyone. I mean, everyone is enjoying this night. So now We will hear from Judith Thomas, the Human Resources Director and Administrator at Proyecto Salud. Judith has learned how to play the guitar during the pandemic and become, believe it or not, a novice songwriter. Let me see. Okay. Sorry, I got a little bit lost. Well, and also she had a song that she published in Facebook with a friend, and they have like a thousands views. So now let's welcome Judith with this story. Judith.
Judith Thomas. Is that the most boring name you ever heard, or what? You will never guess how much fun I am from my name, right? Nor could you tell that I'm Latina and Caribbean. In spite of having a name that doesn't show my Latin roots, I'm proud to be Latina, and I had a great time growing up in Venezuela. I enjoyed having a last name that no one else had, a name that came from a beautiful mix of my Trinidadian dad and my Venezuelan mom. Now, we weren't rich, but we had enough not to worry. My mom taught me that you can't be happy if you don't have the basics covered. And sadly, I saw many families without access to education, healthcare, public services, and food. I learned to figure out how to help them to get those basics. There had to be a way. I wanted everyone to have a shot at good health and happiness, and thus my love for public health was born. I studied nutrition and dietetics at my state university. Then I got a job planning and implementing health education interventions, plus counseling patients with chronic diseases. I was proud of the work I was doing, and I enjoyed interacting with patients, but I also wanted to do more. I wanted to learn more so I could do more. After some research, I decided I should go for a master in public and community health. Only problem, there was not such a master program in Venezuela, although it wasn't unusual. If I wanted to study it, I have to do so in another country. I decided for the United States. How could I go to the United States alone? How could I leave all that I love behind? My country, my friends, my family, my favorite food, my music, and the most important person in my life, my mother. How could I bear to leave? How could I afford it? I just stayed put. There was this inner voice telling me that I should open my mind to growth and opportunities, even ones that seemed out of my reach. The inner voice got louder and louder, and I knew that following it would bring big changes and sacrifices. I didn't know how to do it, but I knew I had to try. So I made the hardest decision I ever made, the decision to leave Venezuela to move to the United States. I saved up money for 2 years, and then in 1999, I left behind everything I knew to move here. Sometimes I went through tough situations that made me ask myself, what am I doing here? But I always found the answer through my faith. I carry God's love with me wherever I go. This is my new home. I want to work hard. And it worked. I got a job as a nutrition consultant at the Proyecto Salud Clinic. Project is one of the safety net clinics serving Montgomery County, and it received great support from PCC. While working full-time at the clinic, I was able to start first English classes and then graduate the graduate program I dream of. Studying in English was much harder than I thought it would be, and studying while working full-time was intense. Adjusting to my new culture was challenging too. I remember one night, I was walking home alone after a long day of work and classes. Another woman walking in front of me looked over her shoulder and started working faster. There must be someone scary behind us, I thought. And without even looking to see who it was, I started working faster too. She went faster and faster until she was practically running when she reached her car, jumped in, and locked the door. Before she pulled away, she looked out the window at me. I saw fear in her eyes. There was no one scary behind me. She was scared of me. Me. I never scared anyone before, and I sensed it had something to do with the color of my skin. But I try not to dwell on being profile. I center my efforts on making things better through my work and studies. Then, before I even finished my first year of studies, my greatest fear came true. In 2002, I suddenly lost my best friend. My mom passed away. I had to pause my work and studies to return to Venezuela. I stayed for 3 months with my father and siblings, grieving and helping each other to get through this rough time. When I made it back to the US, I was more determined than ever. I'm glad I persisted, and not just because I learned a ton and earned my master's degree in public and community health. I also met the sweetest man in the world right here in the United States. Considering he told me on our third day that he knew I was the one for him, it's not surprised that we were married within the year. He's the most supportive person I ever known, and I'm blessed to have him for a life partner. Then, 5 years later, we received the greatest blessing of all. Our beautiful and smart baby Jolene was born. This definitely anchored me to the place that I already called home. Speaking of blessing, I've continued my work at Proyecto this entire time, so in different positions. I realized that my patients here face similar challenges as those from the barrios in Venezuela. Limited access to quality and affordable healthcare, low literacy and poverty. They also struggle with problems that are new to me, such as immigration matters, language barrier, racial disparities, and discrimination. I am honored to be working for an organization that helps people cope with all these problems and more, especially an immigrant myself. I wanted to do more for more people, and I have. I belong here. This is my home, and my life is here. I have no regrets about my decision to move to the US. When our daughter Jeline gets older, I'm looking forward to taking her to visit Venezuela. Someday, we will visit the places I enjoyed so much growing up. She will get to meet her relative, people who loved her before meeting her. We will listen and dance to the music Abuela Jovita loved to sing. Together, we will enjoy my beautiful country of origin before returning to our beloved home here in the US, knowing in our hearts that it's possible to belong to two worlds. Thank you, and God bless you all.
Thank you, Judith. And I really hope you can go back to Venezuela with your daughter. We are so glad you immigrated to the United States. And I want to read some comments in the chat because I like it. This is for Jen, to everyone. I mean, thank you, Judith. They love your story. From Marisol. Oh my God, this is going, don't put too many comments. Thank you, Judith. Pure inspiration. Also, we had one from Stephanie Garibaldi. For Ruben, you are an inspiration. How you got your master's while working full time, raising kids, and coping with chronic pain. I want to be like you when I grow up. Okay, see. What else we have here? For you. Thank you. Thanks, Judith. Immigrants belong to two worlds. I love it. Okay, so now let's continue. Now we will hear from Kay Lu, Clinic Director at the Chinese Culture and Community Service Center, Inc. Kate is a social worker, but COVID-19 turned her into a paraeducator, a full-time cook, and a hairstylist for the whole family, including herself and for her dog too. Kate was recently recognized as one of the 100 heroes by the Maryland Commission for Women. Please welcome the brilliant Kay Lu.
So what is it beside you? Money? Tons of money? So much money that you can roll all over $100 bills covering a king-size bed. I actually have multiple chances at crazy money during the first few years of my career in Shenzhen, China in the 90s. To make it easier for you to understand, Shenzhen, China in the 90s was like the New York's Wall Street. China had just joined the global market, and having a degree in English was my ticket to get into any money-making industry, since speaking English is an essential skill. And banking and investment were the top career choices at my time. Yet, I'd never felt excited about buying original stock share trip and sell them 100 times more in 2 years, or taking a zero interest loan to buy a unit that worth 100 times today. That's how I discovered I am not a money person. So money doesn't excite me. So what does? What's my passion, my real calling? I didn't have an answer until I moved to the US with my husband in 2000. My husband got the opportunity to study business administration on scholarship in the US, and I was his dependent, an adult dependent. That was my official identity when I crossed the border, and I didn't like it. So life was difficult at the beginning as a dependent of an international student. I was not allowed to work or attend school. No job, no money, and very few friends. All I had was plenty of time on my hands, where my husband was so busy studying and networking. I was left alone for most of that time. Now that when I think about it, I realize I lived through my own personal quarantine 20 years ago. I got tons of experience. And that was how far ahead I was with COVID-19. I remember I spent lots of time walking around the forest park in St. Louis every day, taking pictures of the blooming flowers, the falling leaves, and later of my cute little baby boy. The pictures from those days are some of my favorite of all time. Luckily, soon enough, I was out of that domestic jail. I was now free to study and work again. When it was my turn to go back to school, my husband, in an attempt to be helpful, handed me application forms for business school, law school, accounting programs, all the favorite programs the Chinese all go into. And I said, seriously, do you see any accountant in me? Again, I knew I did not want to be an accountant, but I still did not know what I did want to be. So I took a career aptitude assessment test, and the result shows that I clearly belong to some sort of helping profession. Talking to people and helping people are what energized me the most. Better yet, the Graduate School of Social Work at Washington University in St. Louis offered me a scholarship, free education. Hey, I'm in. But it wasn't easy to explain to my husband. He was understandably confused because in China at that time, there's no such a thing as a field of study, let alone a career in social work. It just doesn't exist. The closest thing China has to a social worker is the lowest level government administrator kind of job. He was not thrilled about my choice, of course, and it didn't sound all that promising. But my excitement and my enthusiasm won him over. The study was unlike anything I've ever studied before. All was so interesting. I've got to learn about human behaviors and how someone's environment can have a profound impact in someone's whole life. The best part was that I've learned how to throw a diagnosis at someone that I don't like. I knew I had found my calling at last, and after graduating, I did indeed become a social worker. Even when the work was hard and extra challenging, I still found it preferable to working in banking or investment because the work was at least always meaningful. After serving in child welfare, governmental social programs, in some mental health setting, I happily became the director of the CCACC Pan Asian Volunteer Health Clinic in 2011. This health clinic, as Councilman Gabe Abernathy put it after the visit, is that it's a small but mighty clinic. We accomplished so much with so few resources, and partnering with PCC, we reach far to catch those who fall through the safety net. In order to run such a clinic, I have to dig deeper inside, and I found the creative part of me. Over these 9 years, I created the Stop B program, the Mental Health 360 program, the No Pain Initiative, and the Benefit Enrollment Program. Not exactly medical service itself, but everything around it to make sure our disadvantaged our patients' ever-growing needs are met. There is no such program before, and this program addressed the problem specifically to our community. I want to make an impact, to bring the goodness and the kindness out of people to create a better world. My work is full of rewards, smiles from the patients, rave reviews, and more volunteers joining our service every day. One of our volunteer physicians once said after relocating to Europe, she said that I have no problem leaving my day job at FDA, but I have a real problem leaving my friends and patients at the Pan Asian Volunteer Health Clinic. That is exactly the sense of belonging and the strong community we hope to inspire in patients and volunteers alike. And that's been my experience too. Now that I've found the work that excites me and motivates me, and my true calling and where I belong. There is a Chinese saying, home is where your heart is. I found my home at last, here in Montgomery County, Maryland, in the United States, with my beloved family and rewarding work that excites me. I wish the same for each and every one of you, that you will find your home and work that truly excites you. Thank you.
Thank you, Kate, for sharing such a fascinating story. And I'm gonna read again the line. I love it. The Chinese saying, home is where your heart is. So thank you for your wonderful story. And also we're still having more messages here in the chat, and I wanna share with you. So from Gabby, Kate, what a legacy. From, well, we have wonderful. Thank you, Kate. From Hillary, for Tara, thank you for sharing your story. Wow, so I love all the energy here in the chat. And last but not least, our final storyteller of the night is Jose Yanez. Jose is a fan of retro music, meaning he loves all kinds of music from before his time, because his father's worked as a DJ, and Jose grew up listening to all of his records. He's one of the few 30 years olds you can find rocking out the Bee Gees, Elton John, or Casey and the Sunshine Band. We are so grateful that Jose could be with us tonight to share his story. Jose, bienvenido. Welcome.
I always loved playing soccer. I dream of being a great midfielder someday, like Andres Iniesta. I grew up in El Salvador, where soccer is one of the most important sports, but my parents don't feel the same way as the rest of the country. My father believes that playing soccer is a waste of time. My parents love me, but are also quite strict. So I knew that if I snuck out to play soccer, I'd return home to punishment. But it was worth it. All those days of practice pay off because at 18, I invited to play for a team at the University of El Salvador. Thus, part of my dream has already come true, playing soccer every Friday in a regulation stadium. I also work for a pastor doing accounting. Life is good. As I work and study for my IT degree, El Salvador is a beautiful country with giant pupusas to die for. Then comes May 25th, 2010. When I wake up and go to the college like any other day. After school, I go straight to work until late, and then I go to the supermarket to help my mother buy food. I'm so exhausted that I fell asleep on the way home from the supermarket. I awaken by the sound of something slamming against the car window. I look out to see a man holding a pistol pointed at my father's head. It all happened so fast. The only thing I can do in this living nightmare is jumping. I get out of the car, and the gunman turns toward me. In that split second, I try to grab his gun and move it away from me and my family, but I forget that it's raining. What luck, right? The guy has a raincoat on, and his arm slips from my hands. Then he presses his gun to my right side between my ribs. Bang! There is a camera flash and buzzing in my ears. Like a movie, I fell slowly to the ground. I don't know if it was the poor quality of the gun, or if it was out of the bullets, or if it just wasn't my time to go. But all I hear is a click from the gun when the guy tries to finish the job. He runs away as my mother calls, "I'm calling 911." And my father comes out of the truck to try to help me. We later make it to the hospital, which is a blur of death, x-ray, and painful treatment that caused panic. Luckily, I finally passed out, so I don't remember much of my first 2 weeks there. I wake up to the usual question. How do you feel? Do you know why you are in the hospital? Then they hit me with the bad news. We don't know how long it will be until you can walk. They want to wait to see how my spinal heals to determine if it is going to be a permanent disability. But after 28 days in the hospital, there is no doubt it will be permanent and then take me home. Afraid to leave the house and depressed over my physical condition, I have no desire for anything, no hope of having a normal life again. My parents try to cheer me up, but nothing works. Until we get the unbelievable news that we're going to the United States. After being at home like a zombie, it thrills me to know we're moving far away. But a week after arriving in my new country, my body starts to ache and I have a fever. We go to the hospital thinking it will be for one night. That one night lasts for 3 months as my kidneys were on the verge of collapsing and I needed emergency surgery. 3 months in bed. I am already feeling tired and depressed again. I'll never have a normal life. But I first hear the name Mercy Health Clinic and the hospital. When we are referred to the clinic for future treatments, they have a doctor for every situation and problem, and they are like angels on earth. I came to Mercy Health Clinic, a mere pile of bones, and they helped me to regain my muscle mass, my strength, and my spirit. My treatment requires many medications, including some very expensive ones, so they refer me to MedBank, where they help me pay for medication I can afford. Taking this medication, I'm able to regain my health step by step with Hall's help. They give me my life back. With new strength, my physical therapy begins, and this brings me the wonderful specialists of Hanger's Clinic, the ones who have the huge patience to help me day by day and not give up until they see my progress. They give me the opportunity to feel again what it is to stand up on my own 2 feet. And I remember the first time I stood up, I discovered that my mother, who seemed very tall from my wheelchair, was actually shorter than I am. I'm sorry to tell you this, mother, but just short. It's been 10 years since I lost the ability to walk. At the beginning of my therapies, I was able for stand 10 minutes, and that was a lot for me. Today, I can stand up to 2 hours, and who knows what I'll be able to do in the future. While I understand that I will never be able to play soccer again as before, I look forward to the new challenge life will bring. I want to thank primarily Health Coalition for making possible the joint work of Mercy Health Clinic, MedBank, and Hangers Clinic, because after God, they have been instrument to give me the courage to live and the hope to walk again. I hope the good folks at Primary Care Coalition and their partners will continue to change many lives for the better, just as they did mine. Thank you all.
Thank you, Jose. What a brave story. Thank you for sharing. What an honor, all the stories tonight. So such a powerful for us as an immigrant. Thank you very much to Judith, to Joanna, Ruben, Kaylu, Jose. I had 6, I'm missing 1, and Faith. Yeah, thank you everyone. And now we're gonna go to one message from one of our sponsors and we come back, okay? Don't go anywhere.
Alpha Specialty Pharmacy is proud to sponsor Stories About Belonging. Many of us have personally experienced some of these stories, and we applaud you for sharing yours. Enjoy the stories tonight.
Thank you very much. And now we invite everyone else to stay with us tonight so you can meet our storytellers. But before, let me share with you this value information. We would like to give a special congrats and thank you to Stephanie Garibaldi from Story District, who coached every single storyteller you heard tonight, and to our own Elizabeth Aaron, who makes the storytelling show magic happen on our end. And we hope to see you in person next year at our 3rd annual storytelling show. Until then, on behalf of the Primary Care Coalition, we hope you and your loved ones stay safe and share your own stories. Buenas noches, but please don't go anywhere. If you want to talk to Judith, to Ruben, to Joanna, to Faye, to Jose, stay with us.
Wow, everyone, thank you for those amazing stories.
You're welcome.
Hi, everyone.
Hello.
Yes, well, thank you. Welcome everybody to the after party. Thank you for your support of this event. And particularly thank you for your patience with our earlier technical challenges and perhaps another technical challenge now. As you can tell, I am not Sulema. This is Leslie. But thank you to everyone. Our performers tonight have been honing their stories for months. And if you hadn't stuck around, well then they would have just been practicing again, alone, which they've done a few times before. But with you all here, we've had fun, we've been inspired together, and I love that. Inspired together, that's really just wonderful. And you know, perhaps some of you are thinking about your personal story that you're going to want to share next year at our 3rd annual storytelling event, hopefully in person. A big thank you to our performers who've shared their stories this evening. What courage it takes really to come before an audience and tell such personal stories of belonging, of not belonging at first, finding yourselves. Ruben, particularly telling your story of the pain that you've gone through and how the depths that you were in and how your family has brought you from that. Really inspiring. I'm in awe of each of you who've told your stories tonight, the power and light that you bring to our communities by being who you are. You know, my heart is really just singing, knowing that you all are in this world, doing this work and being in our communities and sharing who you are. So thank you to each and every one of our performers tonight, and thank you to our audience for being here. I also want to thank again our wonderful event sponsors, Care First, Alpha Specialty Pharmacy, NIH Federal Credit Union. I see we have representatives from Alpha. We've got Faribault in the audience here. I think I see him. And we've got Cassandra Hairston from the NIH Federal Credit Union here as well. Thank you for joining and thank you for being sponsors. I want to give a shout out again to George Leventhal, our honoree of this evening, for being with us and for being who he is in the community for so many years as a council member, and now for the work that he's doing in our general region in his new job. I see we're honored tonight to be joined by Delegate Jim Gilchrist, District 17. Thank you for being with us, really appreciate it. So we're here now to have some time together to talk to our storytellers, reflect on the performances, have a little bit of social interaction. So if anybody has a question for our performers.
I have a question for Stephanie because she's the coach. So I want to know all the tips.
Great, go ahead.
Hi, Stephanie.
Hi.
So a few tips to learn to be a good storyteller.
Oh, sure. I would just say one of the things that everyone experienced tonight, and you probably saw tonight, was that you have to be willing to talk about yourself in an honest and kind of vulnerable way. And it's not easy, especially for people like you, Salima, who are so used to telling other people's stories and presenting a lot, but it's a whole different ballgame when you have to speak about your own truth. So I think that's a challenge, but also hopefully enjoyable for people in the long run once they express that part of themselves and have the reward of having people really listen to them and hear their story and get inspired by it. So I think that's the hardest part probably, is getting used to not just saying this happened, this happened, this happened, but saying how you felt about it as you're going and what was going on in your head and your heart.
Okay, thank you for sharing.
Can I ask a question of the storytellers that I'm kind of curious about? And any of you can speak to this, but I'm just curious because I know most of you, this is your first time doing anything like this. So I'm wondering like how different the actual experience was from what you expected when Elizabeth or whoever it was twisted your arm to get you to do this. What was it? How was it different? Were there any surprises for you?
So to me, this is pretty easy. I was like, first, I imagined I was standing in the middle of the stage. And that's actually what I look forward to, because I want to challenge myself. But COVID win us, and so make it easy. And I don't complain. I got some time, fun time.
Yeah, it might have been, I think it was, I kind of felt like I was lost in my story. Because I wasn't looking at, pairs of eyeballs, so I was just lost in the story. I think that was just kind of something that came with the virtual experience, but I'm glad we could make it happen, albeit virtually this year. It was a great experience.
I really enjoy the process because at the beginning in my story, it's like it wasn't easy to go in depth to something that a transition in your life that you have enjoyed so much, but the fact that you have to open, those feelings, those experiences to our audience that particularly I have done with my friends and closest friends, it was a challenge for me, but I really appreciate the opportunity to share my perspective as a professional, as a female, as a woman of color, as an immigrant, to share that, and for people to appreciate and understand where we're coming from.
For me, it was very interesting because I'm really shy. I don't like to talk. I prefer, I really don't like to talk at all, actually. I prefer quiet. But when the opportunity presented, I told my husband, Ruben, I'm only gonna do it if you do it, and said, let's do it. And I was like, oh my God. but then at the same time, seeing how the story, you start with an idea and then it starts developing and turning, putting emotions into it and trying to keep it together without crying. It's really interesting. So, I admire how Faith did it, and I said I had to learn from her. How she did it, I don't know, but I'm gonna try my best. It was really a nice experience, and from the comfort of your own home. So why not?
For me, it was a different experience, and I used to open myself and talk about what happened. This is something very, uh, I will say that when you open yourself to that trauma that you have lived for many years, and then start reviving every moment, and to share this with other people that they might see you that you don't have nothing. You look like a normal person, but inside of your body you feel that sensation that it is unrealistic the way that you live. And the only thing that's for me is make me keep moving is my family. you know and I believe that this is something that we need to share with other people, because there are many who might live in the same condition, that they live every single moment thinking that there is no hope and there is not a future. But it is in your heart, it is in your desire, you want to keep moving. And that's why I decided to do this. When my wife mentioned it, that they were looking for storytellers, so I told her, okay, let's do this. And you don't know, I mean, who empathize with you, who is going to the same situations, and they might not see any hope, any light at the end of the tunnel. For me, there were many years that I live in the conditions that life made no sense. But I think it has to come from your heart and your desire, and not be selfish, thinking about your family, think about your neighbors, think about those who you can serve, even with your limitations. But at the end of the day, you will feel gratified about what you do in your daily basis. And that's the reason why I decided this. Yes, I am very shy. I don't, I avoid to establish a conversation with anyone. But I think that's the first step at the beginning, to break that pattern and open a new horizon. And thank you for this opportunity.
Like a healing for everyone, like telling your own story, like heals your heart. We have 5 more minutes if someone wants to share.
I just want to say to Stephanie, thank you so much for all the help and support. You did an amazing job. I thought at the beginning, oh my God, how am I going to be able to do this? But thank you. I really appreciate it. Thank you so much.
Someone else?
Thank you. And hey, I just want to mention real quickly, I've gotten the question in a private chat, how can we give to PCC? So can somebody with PCC, we've got so many great, powerful PCC people. Can somebody put in the chat just a link to your donation page? Just I don't know if somebody's got that.
Absolutely, we're on it. And thank you.
Yeah, thank you.
Oh my God, is there primarycarecoalition.org? Okay. Yes, is there. Someone else wants to add something or getting ready for next year? Sign up already.
I want to thank you. Thanks, Stephanie. She spent a lot of time with us. She was a great support. Without her guidance, we might not be able to project the story that we did tonight. And She has been very patient with us, giving those instructions, walking through step by step and how to change our story to the way that you have it tonight. Thank you so much, Stephanie.
Thank you. It was such a pleasure working with all of you. You have such amazing stories, and I hope people watching and listening will realize that, you know, you too can find a way to tell your story as compellingly as these people did tonight. And you know, I hope it will be an inspiration, because they were pretty much all first timers. I don't think we had a ringer in the bunch. I think they may have done their share of public speaking, but I think telling their own story was new. So it just goes to show you, anyone can do it. We all have great stories to share, and you know, hopefully, especially through these troubled times, we'll all be able to share our stories more and more, and stay connected with each other.
All powerful stories. I know it's different sitting at home than being in the middle of the stage, so that helps a lot. And remember, you can donate to primarycarecoalition.org. And I appreciate the invitation. It was an honor really to listen to all these wonderful stories. Thank you very much to each of you.
And thank you all. I see that we're getting close to the 9 o'clock hour. I appreciate you, audience, for sticking around till now. So many of you have stayed with us to hear the sort of after story from our storytellers. Thank you again to our performers tonight, our storytellers. Thank you to our sponsors. Thank you to each and every one of you who's been with us this evening. As was mentioned, we welcome donations to continue the work of the Primary Care Coalition. You can donate at our website, primarycarecoalition.org. That's primarycarecoalition.org. And we hope to see you next year in person, we hope.